Good morning. You know, I always say it's a great day to be a Mountaineer, but there are some days that are more special than others, and today is a very great day to be a Mountaineer. These moments only come once or twice in a lifetime, and for me, it was when I asked my wife to marry me and she didn't laugh. But today, we really celebrate a turning point in the ability of this university's research mission to have a real impact on the health and well-being of people across the state of West Virginia and to transform lives and eliminate health disparities. Today, we celebrate the partnerships among the faculty and schools of the Health Sciences Center and the university, the coalitions among key healthcare educational institutions in the state, and resource commitments from our state's two leading healthcare delivery systems to bring state-of-the-art clinical and translational research to West Virginia. It gives me great pleasure to announce that the National Institutes of Health has awarded the Clinical and Translational Research Grant to West Virginia University in the amount of $19.6 million. Our coalition is committing another $33.5 million, and combined, this creates a $53 million project aimed at building the critical research infrastructure that bridges laboratory research with clinical research and population-based research that will be conducted in our hospitals, in our health clinics, and in our communities throughout the state and beyond. I'm pleased to welcome President Clements here to celebrate and to share some of his thoughts about the impact of this grant to the university.
I join with you in welcoming Governor Tomlin to our campus on this historic day, and it is indeed historic. The announcement by the NIH that they have selected WVU for this research initiative is an endorsement from the highest levels of the biomedical research establishment that West Virginia University is on the right path. In our strategic planning, we set a goal that this great flagship land-grant research university will enhance the well-being and the quality of life of the people of West Virginia. Creating the West Virginia Clinical and Translational Sciences Institute will help us to fulfill that goal as we continue to work very hard every single day to eliminate health disparities that affect the people of this great state.
We will be able to recruit, with this new award, 20 or more clinician scientists to the institution, new investigators who will bring additional scientists with them and recruit additional scientists that will build our talent in research and our strengths in research so much to help advance this institution. The infrastructure that this grant will allow us to put in place will not only support the important activities of the grant itself, but it will position our investigators to truly go out and pursue additional opportunities to build on what we start here and really compete for additional awards from the National Institutes of Health, other federal agencies, foundations, and our private partners as well. So it really is just the beginning. This gets us started. Our future is very bright.
Importantly, this research is patient-centric, and more importantly, it has to be responsive to the needs of our community that we serve. So clearly, a large multi-center grant such as this requires support, hard work, dedication, and sacrifice from many groups of people.
As I was preparing for this event this morning, I was reading through the materials which was given to me, and I came across the vision for WVU. That is to attain national research prominence that enhances the well-being of the people of West Virginia by 2020. And President Clements, I must say that with this prestigious grant, I believe that you're well on your way to making that vision a reality, and I say congratulations. My focus is on our people and our future, which means that we need our people to be healthy. So I stay closely involved with the developments in our state's healthcare system. I'm extremely proud of the work that you do here at WVU, and I appreciate your continued commitment to the health and well-being of all West Virginians. As you well know, our state faces some major health concerns. West Virginians have a high rate of obesity-related illnesses. We have a high rate of heart disease, and cancer is a topic too often discussed at the family dinner table. The good news is this: WVU has some of the best, brightest researchers working hard to fight these diseases. This grant is further proof that this flagship institution is doing everything possible to treat those who need help, to research long-term solutions to these conditions. And the best news is this: the NIH recognizes the potential and has awarded WVU with this $20 million grant. This research, the research done with this grant, has the potential to improve and possibly save lives.